Welcome to today's health briefing. We'll be discussing anal warts, a condition affecting the lower digestive tract, exploring its causes, symptoms, and management. Anal warts are primarily caused by the human papillomavirus, or HPV. Specific types of HPV, particularly types 6 and 11, are most commonly responsible. This virus is highly contagious and usually transmitted through direct skin-to-skin contact, most often during anal sex. However, transmission can also occur through other forms of sexual contact or even non-sexual contact in rare instances. Once HPV enters the body, it infects the skin cells around the anus. The virus then triggers these cells to multiply rapidly, leading to the formation of visible warts. The incubation period, the time between initial infection and the appearance of warts, can vary from weeks to months, making it difficult to pinpoint the exact source of infection. The body's immune response plays a crucial role in determining whether an HPV infection will lead to wart development. A weakened immune system can increase the likelihood of wart formation and persistence. Anal warts are a relatively common sexually transmitted infection. Studies suggest that a significant percentage of sexually active adults will contract HPV at some point in their lives. While prevalence rates vary depending on population and geographic location, anal warts are more frequently observed in individuals who engage in anal intercourse, have multiple sexual partners, or have weakened immune systems. It is important to note that some people can be infected with HPV and never develop warts, making it challenging to accurately estimate the true prevalence of the infection. The signs and symptoms of anal warts can vary. Some individuals may have no noticeable symptoms at all. For others, small flesh-colored or gray growths may appear around the anus. These warts can be flat, raised, or cauliflower-like in appearance. Symptoms may include itching, bleeding, pain, or discomfort in the anal area, particularly during bowel movements. In some cases, the warts may grow large enough to cause a feeling of a lump or mass in the anus. Diagnosis of anal warts typically involves a visual examination by a healthcare professional. The doctor will carefully inspect the anal area to identify any visible warts. In some cases, an anoscopy, a procedure that involves inserting a small, lighted scope into the anus, may be performed to examine the anal canal more closely. A biopsy, where a small tissue sample is taken for laboratory analysis, may be necessary to confirm the diagnosis, especially if the warts are atypical in appearance or if there is concern about malignancy. While we don't typically classify anal warts into distinct types beyond those based on HPV strain, it's helpful to consider them based on size, location, and quantity. Some are small and solitary, while others can be large clusters. Their location can range from the perianal skin around the anus to inside the anal canal itself. The treatment approach will often depend on these factors. Treatment for anal warts aims to remove the visible warts. Several treatment options are available, and the choice depends on factors such as the size, number, and location of the warts. Topical medications, such as imiquimod or podophyllitoxin, can be applied directly to the warts. These medications stimulate the immune system or destroy the wart tissue. Surgical removal methods include cryotherapy, which freezes the warts off with liquid nitrogen, electrocautery, which burns the warts off, laser therapy, which uses a laser to destroy the wart tissue, and surgical excision, where the warts are cut out with a scalpel. It's important to understand that treatment removes the warts but does not eliminate the HPV virus from the body. Recurrence is possible, so follow-up care is crucial. Prevention of anal warts primarily involves reducing the risk of HPV infection. Vaccination against HPV is highly effective in preventing infection with the types of HPV that cause most anal warts. The HPV vaccine is recommended for both males and females, ideally before the onset of sexual activity. Practicing safe sex, including using condoms during anal intercourse, can also reduce the risk of transmission. Regular screening for HPV and anal cancer is recommended for individuals at high risk, such as those with HIV or a history of anal warts. The prognosis for anal warts is generally good with appropriate treatment. While the warts can recur, they are usually manageable with continued care. It's important to note that HPV infection can increase the risk of anal cancer, particularly in individuals with weakened immune systems. Therefore, regular follow-up with a healthcare professional is crucial for monitoring and early detection of any potential complications. Recent research is exploring new antiviral therapies and immune-boosting strategies to control HPV infection and prevent wart recurrence, as well as advancements in anal cancer screening techniques to improve early detection rates.